I want to spend a second talking about the incorporation of heat, vibration, and percussion into post-surgical rehab. Now, there's these things, very, very old school, but how do I integrate them and why am I integrating them? So, first of all, I have the HyperIce Venom on here, which does two things. Really, really great heating source. So I can turn this up, and just the heat alone may be sort of analgesic, may give you some relief. The thing about the heat though, is that you're dialing up all the vasculature to start bringing blood flow in, which is absolutely great, but I still want to make sure that I have a mechanism for getting that out, and that would be active contraction or using some kind of compression or some modality, even if it's just wrapping to get it out, right? But one of the things we know is that post-surgically, we often see that these tissues are a little ischemic. We've disrupted blood flow, we've disrupted sort of classic tissue lines, and so bringing blood flow back in and getting them just perfused is great. And again, just getting it hot and warm feels fantastic. Now, one of the nice advantages of this guy is that it gives us an opportunity for some vibration as well. And the vibration is subtle in that, why am I vibrating? Well, one of the things that happens is when we're trying to give people tools to be able to manage their pain, to be able to have on-demand pain relief, vibration is a big one. And now look, we understand that that's temporary, but that's all people need sometimes. They just need some reprieve. So these tissues warm up, the venom starts to vibrate, and what ends up happening then is that it's more difficult for my brain to perceive the sort of sensitized tissues as painful. So because I'm getting this vibration, that vibration is locking out a lot of the signaling from my brain. And so what you can imagine is if a young kid falls and then sprints off, or you whack your hand and shake your hand, it's that movement that suddenly is blocking, because it's traveling up the same pathways to the brain, or similar pathways to the brain. So the brain can't hear everything all at once. So what's nice is that I suddenly have heat, that's a sensory input, and of course blood flow, perfusion, but I also have vibration, which can again give my brain some really some needed sort of pain attenuation. And so being able to modulate my own pain is very powerful, especially when I'm into a long slog of multiple weeks, multiple months rehab, all right? So that is this guy, and I think it's a wonderful tool. Let me pause that. You're gonna see how pink my leg is right now. Oh, it's so pink. But I wanna talk about also the second piece of this thing, which is percussion. So now we're seeing a ton of percussion on the market. This is the HyperVolt by HyperIce. And what I wanna talk about here is a couple things. One is that it's very common for people to have stiffness in the rest of their bodies. So one of the nice things after surgery is that this is an easy way to address some of the tissues that may get stiff just because they're not moving. I probably haven't taken my hip into true hip extension or a lot of hip extension in over a week. I'm 10 days out from my surgery, but the idea of being able to come into my glutes, into my back, make myself feel better is very powerful. That's not what I want to talk about. What I want to talk about is this idea of mechanotransduction, which means that at a cellular level, I need mechanical input for the tissues to express themselves. So one of the things that happens is, even if I'm on my quadriceps here, one of the things that's going on is that I am now loading that tendon. That tendon is vibrating and actually getting some motion. If I add in a little contraction on top of it, it's one of the ways that my brain can begin to move again safely and maybe more comfortably because I have a little bit of distraction. So just like that vibration, this allows me to potentially to begin to access positions or access shapes or access muscle movements, right, limb movements, and all I'm doing is putting a little bit of movement in here at the same time. So all of a sudden, like again, something that my brain may have perceived as threatening or a little bit cautious, suddenly I'm like, hey, I can get a little bit stronger contraction here. It's another way of just getting the tissues to slide and glide. So this tip that I'm using is a little bit grippy. And what this does is it allows me to traction onto the skin so that I can get in here and get a little bit of motion and then actually use that as a kind of gua sha, use that as a kind of tooling or scraping. So instead of just coming into soreness or at least getting these tissues to move, it's a sneaky way for me to restore how these tissues need to slide and glide. And all I'm doing is adding a little bit of load and then just letting that tissue kind of guide how fast the hypervolt needs to move past it. So it's a powerful way for me to just get the tissues to articulate with their kind of sublayers a little bit more effectively. Lastly, I'll just remind you that circulation is the name of the game. So anytime I can improve how my body is managing the lymphatic drainage, managing the congestion is a win. So a couple ways that are very powerful is one is coming into the groin, believe it or not, but thinking about the entire lymphatic system is dumping into the groin, working and getting a little bit of vibration into the groin may change what's going on with the viscosity of the lymphatics so that I'm actually going to get a better drainage. But then working upstream, this is an easy way to suddenly have a little bit of input into the belly, right? Thinking about that these drainage systems are all coming into the center. So working on getting my organs to move, working on getting some movement through my trunk, even you might think, hey, this is subtle sort of input into my organ systems, especially something like the liver, can be very, very powerful in terms of removing stagnation because I'm not moving, I'm not doing a lot of breathing, I'm not loading the way I normally would, and that creates better outflow of the congestion downstream. So when I begin to add this, it can just be as simple as this feels better. Heat and vibration just gives me some reprieve for a moment, allows me to address stiff tissues, but also being able to add this in and look at the amount of loading and the vibration. One of the problems we see with situations where people are beginning to flirt with persistent pain, chronic pain, where pain has gone unmanaged, is that it's the only input their body's getting. So suddenly now, because my tissues are moving, my brain is going to hopefully begin to think, hey, those tissues have been moving. Even though we're not in motion, we're getting a ton of movement in the tissues, and that may be enough for me to begin moving again or downregulate how my brain is thinking about the movement as a threat. Bottom line, input rules. This is a simple and easy way to make yourself feel better.